Measles is an acute infectious disease which usually occurs in children between 6 months and 3 years who have not been immunized or completed a full immunization schedule. It is prevented by 2 doses of measles vaccination at 9 and 18 months. The condition is very infectious from up to 7 days before to 5 days after the appearance of the rash, and complications include otitis media with or without deafness, bronchopneumonia, croup, diarrhea, vitamin A deficiency leading to xerophthalmia and blindness, malnutrition, and also activation of latent tuberculosis. Um, Seriously ill patients requiring admission should be isolated. There is no specific treatment for measles. Antibiotics are not even required except for some specific complications. Measles diagnosis is mainly clinical. The disease is now uncommon because of immunization, but high immunization coverage needs to be maintained to keep the disease under control. So the main cause is measles virus. The symptoms are runny nose, cough, red eyes, sore mouth, high fever, um, which is present before the rash appears. Also, the rash starts on the face and neck, diarrhea, and also the child is generally miserable. So the signs that are usually elicited include fever, conjunctivitis, Koplik spots, as white grain-like spots on the buccal mucosa 2 days before the rash, and also rash is itchy and generalized maculopapular. So investigations, there are usually none. Measles immunoglobulin M as IgM antibody assay if required. So the main treatment objectives are to relieve the symptoms, to maintain good nutrition, and also to prevent and treat complications. Non-pharmacological treatments include tepid sponging for fever, encouraging oral hygiene with frequent saline mouthwash, and also continue feeding with soft high calorie foods, and wash eyes with clean water, discourage use of harsh items on skin. Or pharmacological treatments for pain and fever, usually give paracetamol oral, adults 500 milligrams to 1 gram 6 to 8 hourly. In children 6 to 12 years, give 250 to 500 milligrams 6 to 8 hourly, and 1 to 5 years 120 to 250 milligrams 6 to 8 hourly, and 3 months to 1 year 60 to 120 milligrams 6 to 8 hourly. So to prevent eye complications due to vitamin A deficiency, give vitamin A oral. In children above 1 year, give 200,000 units daily for 2 days, and then between 6 to 11 months, give 100,000 units daily for 2 days, and less than 6 months, 50,000 units daily for 2 days. And management of associated diarrhea with dehydration, and also associated pneumonia and otitis media should be treated appropriately. For relief of skin irritation, you can give calamine lotion, apply liberally to the whole skin. So referral criteria: refer patients with complications such as a black hemorrhagic rash, stridor, pneumonia, coma, even great difficulty in eating or drinking, dehydration or malnutrition to the hospital.